Kansas lawmakers today continue hearings on off-label drug use, specifically for the drugs ivermectin and hydroxychloroquine.
Lawmakers have two proposals. One of these would require doctors to write a prescription simply if a patient asks for it. The other would require pharmacists to fill those prescriptions. Fox 4's Jacob Kittelstadt joins us live from University of Kansas Health System, which sent a letter to lawmakers opposing this. Jake?
Yes, they did. They say that this would shift the doctor-patient relationship, and they also called the bill potentially unsafe. This bill was brought forward by State Senator Mark Steffen, a Republican from Hutchinson. He's also a doctor who, during testimony today, said that he's currently under investigation by the Kansas Board of Healing Arts for his advocacy of these drugs.
I too have been investigated, or I am under investigation by the board for a year and a half now.
State Senator Mark Steffen leads testimony talking about his issues with the Kansas Board of Healing Arts, bemoaning news coverage, and calling out one prominent Kansas voice in particular.
That a lot of this propaganda and broad sweeping statements are being made by KU Health System employed doctors such as Dr. Stites.
Dr. Steve Stites continued that criticism this morning in a call with regional doctors.
And unfortunately, people listen to all sorts of made-up news, and now we're having to reward made-up news with writing a prescription that could easily be disruptive or harmful to somebody, and a pharmacist must fill it.
That's the central idea of the law, to remove roadblocks to getting ivermectin and hydroxychloroquine if a patient wants it to treat COVID-19. Doctors at the largest health systems in Kansas say the proposal is no good and potentially unsafe, being a blanket rule. The Kansas Medical Society also has concerns in the removal of liability for doctors who prescribe the medication.
We don't believe that protects patients or is the appropriate way to govern this. We don't think that legislating on a specific disease state and removing any requirements for professional conduct or liability are in the best interest of patients.
In-person testimony, however, was widely in favor, with doctors saying that patients want the medication.
My practice has grown beyond my capacity to keep up with requests. Patients are seeking doctors who will respect their intelligence and their autonomy.
Now, just a reminder here, you are currently able to get a prescription for these drugs. You just need to work with a doctor who will give you that script and also work with a pharmacist who will fill that script for you. One issue for people giving testimony today was that they don't want pushback that they're currently receiving, especially from these larger healthcare and pharmacy systems. John and Lauren.